Let's react to Stephanie's video, Your Nose Job is a Mess.
From Napoleon Dynamite syndrome to the era of nose job regret.
I hate it so much. I want to cry again.
Okay, let's stop recording for a minute.
It's so
Stop
ugly.
recording. What's ugly about it?
Look at it.
Whoa.
Plastic surgery positivity that is more problematic than positive, the rise of the Barbie nose job and the nose job victims whose noses are on the brink of collapse, and the girlies whose noses are falling off. Welcome to the War of the Noses. Did you know that a nose job is the second most popular plastic surgery in the entire world?
What? Why?
Because people are so damn insecure about their noses, and I get it. Your nose is smack bang in the middle of your face. It's pretty bloody prominent. The damn thing literally protrudes from the center of your face. Hence why if you feel like yours is too big or a bad shape or too round or too flat, your nose will have the power to crush your self-esteem.
Yeah, and for men, it's actually more common for them to be bothered by their hair loss rather than by their nose. But men also undergo rhinoplasty, of course, for cosmetic reasons. But in women, after like breast surgery, and of course after like liposuction, which is even more common, but after breast surgery, rhinoplasty is extremely common. And yeah, it's in the center of the face, and I think that's part of it. Something else that's in the center of the face is, of course, the lips. And that's another popular spot for people to get augmentation or other related procedures.
TikTok is the worst for making girls feel shit about their noses.
Yeah, the most popular age range for a person who's considering a rhinoplasty is usually someone in their 20s. And it can be as young as 15, 16 years old. People start considering cosmetic rhinoplasty. And one of the problems with that demographic is that people will eventually sometimes grow out of wanting a certain procedure. So with rhinoplasty, if you wait long enough, there are definitely going to be some people who decide ultimately not to get it because, they grew out of wanting it. They learned to live with their nose and they're okay with it now. That's part of the reason why I think it's so common. It's because people are going in for that procedure at a younger age. If they waited longer, they might decide that they no longer need it. But that again is in contrast to aging face procedures, for example, or sometimes even, hair loss surgery that tends to occur or people who tend to get that surgery are a little bit older. So they've really thought it through a bit more, and these are some changes that they're seeing a little bit later in life and not so young. It's not like they're born with a hump, let's say, right? It's not like they're necessarily born with hair loss or born with like a super saggy face. That's something that happens to them over time. But with the nose, you might be born with a crooked nose or a big hump on the nose or a tip that is very bulbous and maybe not completely in sync with the rest of the face. And I think that's one of the reasons why people seek these treatments when they're younger. But again, one of the concerns is that maybe they haven't had enough time with their nose to really get comfortable with it, to get used to dealing with people making remarks about it. And, maybe they shouldn't have to do that. Maybe they can just get the adjustment and everything is fine. But as I'm sure we'll see in this video, things are not always fine. There are complications, there are real risks, and there are people who will ultimately regret that decision potentially.
Look at this TikTok. It has 13.5 million views. And all it is this pretty girl using a filter that's giving her all sorts of different nose shapes. And then the filter pops off to reveal her perfect little upturned Barbie nose. And you as a viewer are treated to a smug little smile. You can probably tell that I hate content like this. Like, I don't mean to be snarky, but what is the point of content like this? Here is a surgeon flicking a freshly operated on Cindy nose. Please tell me it's not just me that is slightly disturbed by the fact that we are normalizing putting other people's facial features on ourselves.
That's my buddy. I know him. He's actually a really good rhinoplasty surgeon here in town in New York City, Dr. Reich. Good.
I want this nose. I need this nose. I would pay to have this nose. Oh, shit. I already have it.
It's getting really weird out here. You can literally get what's known as the Barbie nose job. It's disgusting.
Yeah, I mean, compared to the Cindy nose, This Barbie nose to me looks much more extreme. There's a lot more of a separation between the bridge and the tip of the nose, and there's a pretty harsh super tip break and a very pointy tip that to me looks very artificial. Now, do some people want to look artificial? Maybe. I think most people want to look more natural, and they want to, I hope, look like something that exists in nature, right? Like, that's, I think, one of the goals, but maybe for some people it's not. Clearly, people who are wanting this specific type of nose that you're seeing here are not going for natural, especially like when I'm doing hairline design these days. I'm trying to create something that can be seen in the real world, not just something that's created with a scalpel. So, yeah, I guess there's different goals. People have different goals. People who come to me, they want to look natural and for everything to be very like real. And for people to not necessarily notice that they had a procedure. But other people might want something where it's very obvious that something was done, right? I guess different goals, different strokes for different folks, if you will.
Plastic surgeons offering this procedure ought to be ashamed of themselves.
This lady is ready to show off her new Barbie nose.
There are some people who literally market specifically this, that they can create this Barbie nose for anybody and of any ethnicity. So they will take your nose that maybe sometimes is a little bit flatter or a little bit more rounded or has, other characteristics, and they turn it into this Barbie nose. Now, I don't understand that either. I agree with Stephanie on this. I don't think that this should be the new normal. But in some clinics, that is what they do. That is like the nose that they create. And maybe they can create other types of noses if asked. But what happens is when you put that out into the world and you're putting it on Instagram and on your website, you're going to attract patients who want that specific look. So you end up, it's like a snowball effect. You end up getting more of what you put out there. So I agree. I don't think this should be becoming the new normal. I hope it's not. Because one of the issues with making these features so small is that they're very difficult to reverse. And if you cause something like nasal breathing problems or some collapse issues, like it's very hard to build it back up. And now you need cartilage from other places like the ears, the ribs, some cadavers, and it's just very difficult to get it looking more normal again, and then people just keep getting more and more and more surgery to try to correct an issue that in some ways they, and of course the surgeon who did the procedure for them, created in the first place. So, know what you're signing up for. Make sure that you really want this look for the rest of your life, because getting it corrected one day is going to be super expensive and very difficult to do.
Fans are embracing all things Barbie, including her nose.
I really wanted like this cute little Barbie face-tuned nose. I wanted a thinner bridge. I wanted my nostrils in a little bit more, and I definitely wanted most of the work to be tip focused.
Yeah, people tend to want smaller. They want more narrow, they want smaller, and they want it in all the components and all the areas. You got the bridge, you got the tip, you got the ala, right? The most common areas, and they want it smaller in all three places generally.
I loved Barbie's nose. I think it's really cute. It's just buttony.
And I think that the recent push with the movie, even though, I don't know, I think maybe part of the goal of the movie was to make people less focused on their appearance and kind of get to some deeper message. But maybe unintentionally or maybe intentionally, I don't know, it led to people, being more fixated on creating these Barbie noses, which is kind of crazy to think about. But that is definitely, I think, some consequence of the recent, movie that came out.
The thing is, a good nose job shouldn't really be that noticeable.
I agree with Stephanie on this one. I think that good plastic surgery should whisper, not scream. And I think that it's okay from a surgeon's perspective to say no to a patient who wants something that's going to look completely like unnatural, But I think with different market pressures and, certain, types of, maybe some surgeons want that look for their patients. Maybe they're into that themselves. I don't know. There's, of course, some subjectivity here. But, I think when you look back, in the future, you look back on what we're doing now, I think you, first of all, from the surgeon's perspective, you want to be proud of your work. And I don't think that just giving in to the latest fad is something that, you're necessarily going to be proud of later on. So that's from the surgeon's perspective. But from a patient's perspective, again, you want to look normal when you're like much older too. Things that you do in your late teens goes for other things too, not just cosmetic surgery, like tattoos, right? When you're like 70 and 80 years old, you're going to have to live with that, whatever you ended up getting when you were in college, right? So anyway, it's an important consideration. Like, how are you going to look in the future? Are you going to be proud of that look many years later? That's something to consider.
People will argue they did. People will argue they didn't. But if you look very closely at side-by-side profile pictures, you can see that there are very subtle changes. And if you look even closer than that, you'll see that there are very, very subtle scars. It's almost like celebrities are engaged in a war against each other to see who can have the most unnecessary nose job.
And again, there's a way to do this where things get smaller, they get more narrow, but it still stays true to like your original nose and to your original face. And I think that's the key with nasal procedures and other cosmetic procedures, is for everything to be in sync and for one feature to not attract too much attention. Because if a feature attracts too much attention, then it probably was not great work. It should be all blended together when you look at the face. And if anything, attention should be more focused on the eyes. That's a good place to bring focus rather than specifically on the nose.
Now this TikTok really boils my blood. Not this girl in particular. She hasn't actually done anything wrong. We don't actually get to see her original nose in this video, but the fact that she's using Madison Beer and Cindy Kimberly as her examples of the nose she wants, girl, this is a problem. Just because these noses look good on these two girls does not mean that this same nose is going to look good on you.
True. That's true. Yeah, I mean, everyone has different facial features and everything has to work well together. I don't like, honestly, when patients bring in celebrity photos and say, I want to look like this. Sometimes for general inspiration, it might be okay, but you always have to be so careful in not promising the patient that, hey, you're going to get, so-and-so's nose. It just doesn't work that way. I mean, we have certain structures internally too that you can't just completely modify and create just anything you want. So that's something to really consider. And of course, the nasal skin envelope also plays a role. If you have really thick nasal skin, it's difficult to make it so that every little feature of the nose looks very fine and petite because you still have this thick skin envelope that's going to drape over all of those inner structures.
I know we are being bombarded with this messaging that the tiny button nose looks good on everybody and every girl should have this nose. I remember as a teenager desperately trying
Sometimes we call that like a polybeak type of appearance, and that's not to be rude. That's like an actual technical clinical term, which I know sounds kind of rude, but that's sort of the technical terminology.
and to make smaller than my left.
Yeah, and nostrils are like never the same from one side to the other because our faces are asymmetrical, and I talk about that often on this channel. Because the nose is a central structure, you can really see that nostril asymmetry, and it's a three-dimensional difference. Usually one side is a little wider than the other side or a bit more rounded. So when patients come in saying like, can you make the nostrils exactly the same? It's usually impossible. So that's something to keep in mind. But I think Stephanie uses makeup to try to make the nose look a little bit straighter and, to try to contour it the best you can.
There's nothing really wrong with your nose. I mean, I can smell fine. I can breathe very well. I've been hit in the face with balls more times than I can count, and not once has my nose broken. This thing is built like a tank. Here is a picture of me and my darling sister. As you can see, we look nothing alike. I mean, you could literally fit 4 of her nose inside my nose. Growing up, I was so jealous, but not anymore. Not because I don't like her nose. I think it's gorgeous. On her. I now realize that her nose would not suit my face. I have a big head. I also have big features. I need a big nose to balance out the rest of my face. Whereas my sister has a petite head and petite features that suit her. We are not created the same. A tiny button nose is not compatible with every face.
Yeah, it's true that as we start to remove cartilage, right, to make these noses look smaller and smaller, we are essentially weakening the nose. This is true. So if you're involved in like a motor vehicle accident or some other, accident with whatever balls flying at your face, surely you're at higher risk for having some additional, say, fractures of the cartilage or of the bone, because now it's a bit weaker. There's less of it there. Or maybe there's been grafts placed, which might also create a little bit of weakening. It just depends on how it's done, of course, but that is a potential risk of having a rhinoplasty too. Now, sometimes rhinoplasties are done to build things up and properly supported with cartilage grafts and all of that, and that's great, and that could sustain more trauma. But other times, they're heavily weakened by the removal of cartilage, and that can give you functional problems like breathing issues, and it can also give you a higher risk for new problems if you were to sustain some nasal trauma.
If you have large features, chances are you need a large nose to balance out your face. Noses are not a one-size-fits-all thing. Take a look at Lana Del Rey. Real name, Lizzie Grant. This is the Lana Del Rey we all know and love today. But this is original Lana. As you can see, this is not Lana's natural nose. And if you ask me, it's a damn shame. Her original nose looks very functional, very elegant. Don't even try and tell me it was ugly. If I had to choose between the two, I'd pick the original. And that's not me trying to be mean. That's me wondering how on earth her plastic surgeon thought putting this nose on Lana's face was a good idea. Because to make matters even worse, it looks like Lana's new nose is on the verge of collapse. I don't mean to scare you, but yes guys, that's a thing. It's called nasal valve collapse, and it's caused by weakened cartilage.
Well, nasal collapse comes in a few different flavors. One is that the lateral nasal wall can be weakened. If you thin out the lateral crura, which is often done with different manipulations to the nasal tip, you will potentially cause some lateral nasal wall collapse. Now, that's different from creating what's called a saddle nose, where you get collapse of the actual bridge of the nose. So there's potential collapse of the bridge cartilage, but there's also potential collapse of the lateral nasal sidewall. Both can lead to breathing problems, and both can lead to cosmetic irregularities as well, and might not look great.
Then there's poor Charlotte Crosby, UK reality star and influencer who was cursed with this natural nose. Unfortunately for Charlotte, being on TV made her hyper aware that her nose did not fit our beauty standard. Tell me it's not just me that sees her natural nose and thinks, God, she was cute. She was so pretty. So let's acknowledge the fact here that your nose isn't on your face alone. Your nose is framed by the rest of your facial features. And when you look at Charlotte's original face with her original nose framed by her facial features, it all fits. It all balances. It just works. This, my friends, is Charlotte now. Yes, as you can see, she had a nose job. Is she still very beautiful? Of course she is. But when you look at her face as a whole, I can't help but think that this new nose doesn't quite fit.
Yeah, the rest of her features are quite full, and then you have this little tiny nose in the middle, and I agree, it doesn't necessarily all balance out. The lips are big, the cheeks are big, even the forehead bone, the frontal bone, has some prominence to it. So yeah, I think that Stephanie brings up a really good point here.
Sure, her nose is smaller, but does she look prettier? I think she was perfectly pretty to begin with. And before you jump on your keyboard and as long as she's happy with her
Smaller is not always better, and that I think is the real message here.
new nose, that's all that matters. I do agree with you to an extent, but the thing is, it's a shame that she was made to feel inadequate with her original nose to begin with.
I never had any problem with my nose, but the more and more I saw it on telly and how big the hump was from the side.
Yeah, it's what you see if you're on TV, but it's also the commentaries. People can be pretty nasty. And trying to placate others can be full of problems, because where does it end? First they make fun of your nose, so you run and get the rhinoplasty. Then it's, your brows are sagging, so you run and fix that. Then it's like hair loss. Then, it never ends and you can never please everybody. So I think at some point we have to learn to accept ourselves and just move on. I think that is an important message too. And might sound weird coming from a plastic surgeon, but as you guys know, we're not here to push plastic surgery. We're here to say that there is a time and a place for plastic surgery when it's appropriate and when it can truly enhance, not when it can create problems and distort and do other problematic things. It's hard though. People are under immense pressure to look a certain way, to behave a certain way, and it's really hard out there.
Let's not gloss over the fact that surgical rhinoplasty is not a pleasant procedure. It's not a small procedure either.
Yeah, these are surgeries performed under general anesthesia, so the biggest risk is actually the actual anesthesia component of it rather than the surgery itself. There, of course, are risks of having nasal surgery, infection, bleeding, nasal, collapse, problems like that. But when you look at the anesthetic risks and what some of the different inhalational drugs and IV, medications, what that can potentially do to your cardiovascular system, also the whole intubation part, you have a machine that's breathing for you during the surgery potentially. That's where your real life-threatening risks come in. All of those things need to be considered when you're looking to make your nose a little smaller. And it has to be weighed against the potential benefits, risks and benefits. It's always trying to find that balance. As you guys might know, I used to do a lot of rhinoplasty, especially for the VA system, where I did a lot of revision work and complex functional rhinoplasties. I also did cosmetic rhinoplasties in my practice. And about 2 years ago, I basically stopped and I decided to focus my practice mainly on hair surgery and on cosmetic lip surgery. And I really haven't looked back. I think a rhinoplasty is a very powerful surgery, both for functional reasons and what it can do for a person cosmetically, but it has to be handled with care. And I think if you're looking to get a rhinoplasty, you should really go to people who focus specifically on that procedure and not just offer, lots of other things. It has to be handled with care. We have a beauty experts section on our Feel Confident website. You can feel free to check that out. We have some recommended surgeons on there, but be careful out there.
The era of nose job regret, which is exactly what it says on the tin. People who have undergone a nose job hoping it was going to improve their confidence, make them look prettier, make them feel happier, but it didn't.
I just want my old nose back.
Revision rates after primary rhinoplasties are actually really high. And there's also the category of people who regret having had the rhinoplasty, but maybe they don't undergo a revision because they can't afford it, or they don't want to go through the emotional or physical trauma of another surgery. So it's actually extremely high. I don't know the exact numbers on revision rates overall, but I think they're not just revision rates, but dissatisfaction rates from primary rhinoplasties. But I think they're very high. And of course, those revision rates and the satisfaction is going to be different from one surgeon to another. So it's hard to sometimes get the real numbers, but I think in general, these numbers are usually underreported because people want to show, their best results. They want to tell everyone how, happy their patients are. But of course, there are going to be people who are not satisfied. And that goes for other plastic surgeries, of course, too. It's not just rhinoplasty.
Because I hate it so much. And I want to cry again. Okay. So this is OG Italian nose. I can kind of get an idea of what my nose will look like, and I'm really excited about it. This is my new face. After that video, I went to go take photos for Instagram, and that's when everything went downhill. I've been taking photos for an hour and I haven't even gotten one. I'm freaking out. I know it's still swollen, but holy crap. What did you do?
Doesn't look that bad to me.
I'm really not okay. I don't want anybody to see me right now. I barely want to look at myself. I thought this was what I wanted.
It looks a bit swollen, but I don't know what she started with, but I don't see anything glaringly problematic.
I avoided all this if I just If I just accepted my nose, I just want my own nose back.
Well, again, I don't see anything that's like clearly wrong. And that's what's difficult, right? From the surgeon's perspective, when you have a patient who is just unhappy, like there maybe was no complication, they maybe look similar to what was promised to them, that's possible. And yet they're just not happy because they never were able to see exactly what the nose would look like, that modified nose on their face, right? Even if you give them a simulation picture, that's one thing, but seeing it and living with it is very different. And you don't always know how the patient will react to that. And that can be very challenging to deal with, especially, for the patient, but also from the surgeon's perspective, because you want to be supportive and you want to be kind and you want to be understanding. But it's also like, well, we did what you signed up for, if that of course is the case. I have no idea who this person is, or if they wanted something totally different, and if that wasn't delivered, maybe that was her case, I don't know. But there are plenty of scenarios like I described where what is asked for is delivered by the surgeon, and yet the patient is still unhappy because they didn't know what it would look like and what it would feel like to live with this new nose, or these new set of lips, or these new whatever it is, the brows being lifted, or the eyes being pulled, or a new hairline. It takes time to adapt to that, and there's no way to fully tell if you're going to love it beforehand. So that's part of the risk that patients take when they sign up for these surgeries. So I would say to people to think long and hard before you go and get a cosmetic plastic surgery. You really want to be 100% sure that this is the thing that will be right for you. And of course, do your due diligence in finding the right surgeon as well.
I will never have that exact nose again. So mad at myself. This is the stupidest thing I've done. I wouldn't be going through this crap right now if I just loved the nose that was given to me.
Yeah, I think self-acceptance is so important. And if people can get to that without plastic surgery, that's always better. Sometimes plastic surgery can help boost you to that state of mind. But you don't want to jump the gun and make decisions rashly when it comes to, an actual surgery, especially in the center of your face. So think long and hard before you do it.
And there's the uncomfortable truth that people rarely stop at just one nose job. Nose job dissatisfaction is unfortunately so common.
Exactly what I was saying before.
And I can see why. I mean, you're entrusting your face to someone else to change it how they see fit. So it just makes sense that sometimes you're not going to be happy with it.
And it's not just like every element is in the surgeon's control either. Sometimes like you put the cartilage in one place and then a few months go by and some stitch fell out or broke apart, or something moved, or the healing process shifted the cartilage graft that you put in, and then all of a sudden you have a different appearance. And so even if you put it there, or you didn't intend as the surgeon for something to be in a certain position, it might end up in that position anyway. So it's not just like you're entrusting it to a surgeon and they can control every last thing. Especially with the healing process, we can't control all of it, kind of like it does its thing, before, you close the nose, you make sure everything looks good. When you close the nose, you check again, okay, everything looks good. But then there's the healing process, and then we see what we get and we go from there.
I hate my nose, it's very piggy.
You had your nose done and you don't like it?
Yeah, I don't like my nose. Now I feel like I need to get another nose job.
So she said it looks too piggy, so that comes from over-rotating the nose and from the nostril show. And so that sometimes, can give a more kind of piggy type of appearance.
You felt you had a problem with your nose and you wanted it made smaller, yeah?
Yeah, well, I can't smell and I can't actually breathe through my nose anymore.
Was it the first surgery you had on your nose?
It was the second. My first nose surgery was on Harley Street with obviously a British surgeon, and I just felt like the results were very conservative and very minimal. I just wanted it to look quite small.
But you see, if she's coming to a surgeon with the goal cosmetically of having this little fine nose, the surgeon needs to explain that it's a trade-off, right? Because if I make the nose smaller, things could collapse, things could, you might be breathing worse. that is a real potential trade-off. And even with the best cartilage grafting and all of that, if you make the nose really small, you run all of those risks. So I hope that that was explained to this person, and that maybe it wasn't, but maybe despite all that, she still said, you know what? I'm willing to take those risks. Let's go for it. And then if you're left with this, small nose that doesn't function well, you can still be unhappy. But I think as the patient, you need to accept some ownership over that type of result, right? I don't think you can just go and point fingers and say, oh my God, these surgeons are terrible. That is a part of this. That is a real part of it, that patients need to do their due diligence to find a great surgeon who will give you honest advice, but also understand what the real risks are of some of the things that you're asking for. So it's a balance, and it's never popular to blame the patient and ask something of the patient. But in reality, I think this is cosmetic surgery. The patients need to do their homework. Surgeons need to do their part in keeping people safe and educating. But the two sides need to work together, right? So that's super important. But as the patient, even just protecting yourself, you really want to learn as much as possible about all these surgeries, about the risks, before you go and ask for something that can create a potential problem. Because you might have a surgeon who's just trying to do what you ask them to do usually you sign things where there's like a whole lot of risks, and they're not trying to create problems for you. But the risk will be higher as you ask for certain things like a really small nose.
When I looked at my nose, there wasn't much difference. It wasn't the tiny nose I'd wanted. So I had my second nose job. 3 years later, I decided to get my boobs done again. When I went for my consultation with him, he looked at my nose and he said, your nose has collapsed, in that accent. So he'd offered me a revision. He said he'd had to take some of my rib and put into my nose.
That's what I was saying earlier, that like these revision surgeries get so complicated. Now you have to like cut open, the ribs and take a piece of the rib and put it in the nose, and you don't know if that's going to work. And then you have this like really super stiff nose. That's often something that doesn't get discussed enough. I think that like with especially rib grafting or a lot of these revision cases, people get super stiff noses, right? And then that doesn't, like, it might look good, but like it doesn't feel natural. And when you go to kiss someone, or you go to eat something, or you go to sometimes just touch the area, and you're like, why is this like so super hard? And then like that also might just feel foreign to you, so there are all these potential problems, so don't create the problem in the first place. And this goes for surgeon and of course for patient as well. So think about these potential things that can occur before you even undergo your first rhinoplasty.
Well, that was a bit stupid, because now I have the sausage rib that sticks out my nose. The worst nose ever, and I hate it.
Perhaps so many people regret their nose jobs because a nose job wasn't what they needed in the first place. This section might very well blow your mind. Have you ever seen the movie Napoleon Dynamite? Do you see this nose and this chin shape? This, my friends, is called adenoid face. If your nose and chin look like this, you don't need a nose job, you need to fix your breathing.
Yeah, this came up in the mewing video that I did, where people have these underdeveloped jaws and this kind of crowding of their teeth and the mouth breathing that sometimes accounts for these different types of facial appearances.
If you look like this, the problem is not your nose, the problem is your airways. You may have what's known as a tongue tie, which starts when you're a baby and is super common, but if it isn't fixed when you're a baby, your whole mouth, nose, and airways can grow incorrectly.
Yeah, most of this isn't necessarily tied, no pun intended, to tongue tie. That is not the primary reason for this type of appearance or these kind of adenoid faces. It's not just because of the tongue tie.
Your whole mouth, nose, and airways can grow incorrectly, resulting in the Napoleon Dynamite look. If you were a kid who suffered from chronic nasal congestion or frequent colds and flus or allergies, you probably learned to breathe through your mouth instead of your nose because your nose was always blocked. And so your face forms like this. If you look anything like Napoleon Dynamite, you don't need a plastic surgeon. What you need is a myofunctional therapist.
There's definitely a limit to how much of this you can change later in life. So making some of these adjustments earlier in life can surely lead to some differences in the way that your bone structures develop and all of that. Changes that you do in terms of like lifestyle and these different Breathe Institute, as far as like, later in life, are less likely to really impact the overall appearance. Yeah, you're not going to just be able to do some breathing exercises and go from this image of this person on the right to the image of the person on the left. It's just not happening without some additional surgical intervention. And that's part of the issue with the whole kind of mewing movement, in that, yeah, like a lot of the things that they say and that you can do are quite effective when our bones are still developing, but later in life, it doesn't lead to this significant of a change. Maybe some more minimal change, but nothing this robust and transformative.
If your chin is all the way back here because your jaw has developed incorrectly from your breathing since you were a child, suddenly your nose looks way too prominent. But once your breathing and your jaw issues are fixed, suddenly your nose is fine.
Yeah, and it's always a good idea when considering a rhinoplasty, or from the surgeon's perspective, to assess the profile and to assess the chin position. Because sometimes, like she's saying, the nose can look over projected, but in reality, it's because the chin is recessed. And whether or not that's from mouth breathing when you're younger, or whether or not you have an underdeveloped mandible, regardless of the reason, you still have this disproportionate appearance, and potentially you can avoid a rhinoplasty if you just augment the chin, if that satisfies all the goals of what you were going for. Or you can just bring more balance to the face and more harmony by addressing the chin when doing the rhinoplasty, or whatever, before or after doing the rhinoplasty, but addressing both can sometimes bring this improved harmony.
Now, if you thought that you had to undergo literal surgical rhinoplasty to change the shape of your nose, think again. You can get what's known as a non-surgical nose job. This is where they use filler, yes, that kind of filler, and they actually make your nose bigger to change your nose's shape.
And we have a video on YouTube where we compare the results of like a liquid rhinoplasty, which is what this is talking about, which is filler into the nose, versus surgical rhinoplasty, and we compare and contrast. So make sure to check that video out. It's from a while back, but it's still highly relevant.
Wow, I mean, that is it strangely looks smaller.
That's quite clever.
It works for some, and some people are able to avoid rhinoplasty altogether. And the good thing with filler in the nose is that it lasts for a long time. So for sometimes several years, and you can put more permanent type of filler into the nose as well. And there are, of course, people who specialize specifically on this type of nasal filler procedure. Of course, with filler in the nose, you have to be very careful of blood vessels, because you can get big problems like vascular occlusion, necrosis, bad things can happen. So you have to go to someone who's really good at specifically this type of injection. And the other thing I'll say is that after a rhinoplasty, some people, they don't want to get revision work, or the surgeon might not feel like it's warranted to go back in there, or to go back in at an early time point. So sometimes there's filler procedures that are performed after a rhinoplasty. In many cases, that increases the risk of vascular occlusion. So you have to be very careful getting filler after having had a rhinoplasty, but in experienced hands, it can still overall be safe.
Now, in case you've sat here watching this whole video and you're like, Steph, bugger you, I do what I want. You can keep your big nose, but I'm fixing mine. That's fine. I genuinely only want the best for you. And if you truly believe that a nose job is going to make you feel more confident and better about yourself, then I genuinely hope that your new nose makes you feel amazing, because you deserve to feel good about yourself.
Yeah, with the right pairing of a patient with realistic expectations and someone who's really thought it through and really wants a specific change to their nose, and finding the right surgeon who's able to create that change safely, of course, that can lead to overall high satisfaction results and nice, aesthetically pleasing outcomes as well.